Hello, I'm Dr. Richard R.P. Warner. I'd like to describe my style of patient care for your interest. I conduct a consultative practice for carcinoid and related neuroendocrine tumors, and I also do clinical research in this field. And I've been doing this for a long time. Actually, I've been involved in this area for over half a century. Originally, just after the first description of carcinoid syndrome appeared in the medical journals and was accepted as a specific disease entity, I encountered two cases which appeared to have carcinoid syndrome. But unlike the original cases, which were due to the development of carcinoid tumors in the intestine, these two new cases were carcinoids that developed in the lung. And so I described the first cases of carcinoid syndrome from lung carcinoids. In order to establish those diagnoses, I had to set up a laboratory analysis for measuring urinary 5-HIAA, at that time, the chemical way of confirming the diagnosis. And from that, a laboratory developed that I ran for 40 years, and eventually we measured blood serotonin and other related substances such as histamine and other things that these tumors may produce and are useful for diagnostic purposes. Because of this laboratory, I began to see an increasing number of these type patients and became expert at carcinoid and neuroendocrine tumor diseases. And with the passage of time, I became familiar with every different type of treatment that was developed. In fact, I assisted in the development of some. And currently, my overriding philosophy in management is that of being proactive. Originally, years ago, there was nothing available except surgery, and if the tumor had spread, there wasn't much you could do about it. Now, we can do a lot about it. And so, I don't believe in the antiquated philosophy of watch and wait and see, but rather use one or another or multiple modalities that are now available and can make a big difference in quality of life and length of survival. And so what I really want prospective patients to know about me would be that I am proactive. That doesn't mean I'm harsh and inappropriately aggressive, but rather customize the recommended treatments for each patient's particular needs. And so, with that being said, I thank you for your attention and wish you all good health.